Hello, everyone, and welcome. We're going to give folks just a few seconds to migrate in from the waiting room, and then we'll get started. Good morning and welcome to Open Enrollment is Coming. I'm Randy Stevens, Business Relationship Manager for the New Jersey Business and Industry Association. With us today are Kevin Kuczynski, Chief Operating Officer of Princeton Partners, Harvey Mishkin, Chief Operating Officer, and Mike Lenahan, Marketing Director, both from Association Member Trusts. In order to not eat into too much of their time, I'm going to give you an abbreviated bio for Kevin, Harvey, and Mike. Kevin is the Chief Operating Officer at Princeton Partners, who's a game-changing innovator and proven leader in the corporate, governmental, and nonprofit sectors with a 25-plus-year track record of success. Mike is the Marketing Director at Association Member Trust with 30 years of experience. And Harvey is the Chief Operating Officer at Association Member Trust with more than 30 years in the field. Mr. Mishkin is recognized as one of the leading authorities in group healthcare coverage for employees and their dependents. A few housekeeping matters before we get started. Today's webinar is being recorded and will be emailed to you by the end of the week, along with the PowerPoint from today's presentation. So be on the lookout for those. If you just can't wait, you can download them right now from the Handouts tab. I'd also like to draw your attention to the Questions tab. Kevin, Harvey, and Mike will be happy to take your questions at the end. So get them in as they come to you via the Questions chat box. If you have any trouble viewing or hearing during this presentation, don't forget, you will automatically be receiving a recording. So if you have to sign out, you can rewatch the recording later. So now, without further ado, Kevin, take us away.
Good morning, everyone, and thank you. I wanted to take a moment, welcome you to today's webinar on open enrollment. We're happy to have Association Member Trust here with us, and really, we want to talk today about better health plan options for small businesses like yours. As you saw in the invite for this session, we're going to first start by talking about how the healthcare market in New Jersey is changing and the challenges that creates for small business owners. We'll then give some brief background on Association Member Trust and the value it brings to members. And we're going to talk a lot today about the value of completing a health plan checkup to make sure you have the right coverage and the right cost for you and your employees. Harvey and Mike are then going to go on to some newer AMT plan options that deliver better value, that help you balance in-network coverage with that out-of-network safety net, and some of the newer plans. We'll then go into some specific real-life examples of how much you can save in case studies, and we'll finish with AMT's newest benefit for small businesses, which is a new concierge level of service through Horizon Advocate. So we'll finish with questions and answers. So Harvey, why don't you take us this way?
Great. Well, thank you, Kevin, and good morning, everybody. We very much appreciate you spending a few minutes with us this morning to learn about AMT. And as Kevin said, it is open enrollment time. So it's time to, evaluate your health plan, see what type of options you have, what you need, and what might be available to you, especially in the terms of value. You know, COVID-19 was the most challenging time for this industry, whether it be our plan or really all plans out there in the marketplace. Unfortunately, when the pandemic first hit, if you remember back early in 2020, a number of elected services were postponed or not done. Trips to the doctor were less frequent. Things like routine physicals and those type of things weren't being done. And then about halfway through the year 2020, those things started to change. Elective surgeries started to happen again. People who had avoided treatment previously were starting to get treatment, and that continued, and it made for a very unpredictable time for this industry through the second half of 2020 and really through 21 as well. Costs have really escalated. particularly in the cost of the particular claim. You know, we tend to think that, you know, because there were less people seeing doctors, those with conditions got to be a little bit worse than they would have been. And that has caused, you know, a higher level of claim as we go through the world. And of course, when claims rise, you know, so do premiums. And so employers now have to, you know, look at some costs and in some cases, you know, very significant rate action. So as open enrollment approaches, it's great to know what type of options are out there, the different healthcare platforms that are available to you. One of the key areas and one of the things that we'll focus on today, you know, is the availability of out-of-network provider services. You know, what we have found is that costs related to that segment, you know, have really increased dramatically, which caused really every carrier to take some note, both either in rate action, you know, or in benefit design. And you know, AMT is not really different when it comes to that. One of the things that is different is that, particularly for the small employer, it's much harder to find an out-of-network plan today that will offer coverage for those providers that are out. So something that you also want to keep in mind. And again, you want to evaluate how important is that coverage. You know, when we look at our claims, 95% of our claims come in through network providers. So in many instances, we find that employers are spending money for a benefit that many times they and their employees never use. It's kind of like a what if scenario, and that can be really costly. So it's something that you should take a look at. That's made the navigation, you know, of health plans, it's more complex than it used to be because the costs are certainly up, and the options in the standard market seem to be a little bit less. So again, it's hard for owners to try to evaluate the different options and to piece together the right coverage, you know, based on both cost and availability of benefit. And that's something that I think we're very proud to help you through. You know, AMT is very different type of plan, and we're essentially a member service, you know, to the association that you participate in, like in this case, BIA. We will give you very clear and unbiased information so that you can make the best decision possible for you and your employees. Obviously, we'll show you the options that AMT has, which we think are you know, really terrific when compared to the standard market. But again, you'll get clear information from us to help you make your choices. And the last thing, you know, AMT has always been about service. It's a key to AMT. You know, at AMT for all of our years, you've had dedicated account reps that can help you through, you know, any type of problem, whether it be, you know, I need to add a new employee or terminate an employee, or I want to talk about changing my coverage. You know, we've always been here to help you. And unfortunately, when people suffer, you know, that really large, that debilitating illness, you know, we're there to help you through the claim process. We have dedicated staff with access into the Horizon system so that we can kind of track the claim and make sure that it's being processed correctly. The last thing that we'll talk about a little bit later is the new Horizon Advocate program, which is available to large groups in New Jersey, and that AMT is bought into that as well. So we have a lot to talk about. You know, AMT with more options and more health. If we jump to the slide that talks about the value of AMT, you know, just quickly, AMT is different than your typical carrier program. It's a unique plan. It's built through association participation, but it's structured as a not-for-profit trust. Our goal every year is to break even. That's very different than the insurance carriers that have you know, stockholders that need to be satisfied. We're simply about breaking even. And when there's money left over, and we've accounted for all of our expenses, including future reserving, the plan pays dividends back to the members that participate. And, you know, over the last 10 years or so, I think that we've paid back in the neighborhood of $18 million to our members. Something just based on our experience through the plan. It wasn't mandated by any governmental action. It just means giving that money back whenever we can. So that's something that you generally will not find anywhere else. Our plan is self-funded so that we can continue to bring you what we think are a little bit better coverages, health plan options that promote value. And again, we are all about customer service at the best cost possible. Currently, there are 17 associations that participate in AMT. And one thing that is very different is AMT is run by a board of trustees. Every association has representation on that board. And what that means to you is that you have a voice in the direction of the program. You won't get that anywhere else. Those trustees have the responsibility, the fiduciary responsibility for plan operations. So, everything from, financial to the benefit plans that are available to our members, to the service you receive, is all run through the trustees. And you have a voice to that trustee, not only to us here at management levels at AMT, but also through that board. You won't find that anywhere else. And so again, we want to work on your behalf. We want to help you choose the right coverage, for you and your employees. We'll provide you unbiased information on what we think your best options are. And today you'll see that our association, there is strength in numbers. And again, 17 participating New Jersey associations with approximately 2,200 participating employers. We're going to cover about 18,000 lives, and our revenues will be somewhere between 135 and 140 million dollars this year. So again, a lot of strength in numbers. I'd like to turn it over to Mike Lenihan to talk to more about how AMT works and with our plan options and networks.
Thanks, Harvey. So AMT is different. We are a unique multi-employer trust. At AMT, we have well over 200 plan options. We've got a number of different medical plans with different RX options. And so if you multiply the RX option available for each medical plan, we've got well over 200. We have plan options available on every, what I would call, delivery system. So we've got direct access plans and PPO plans. Those plans will let you go in and out of network. We also have EPO plans and Omnia plans. Those are network only plans. We have HSA compatible plans on all of those delivery options. We also have HRA availability to wrap around any plan. We've partnered with Mellon Bank as the HSA and HRA vendor. So both of those add-ons are available through AMT without any cost. It's turnkey, very easy to use. And so together, we'd like to help you find the plan that best meets your needs. Our network partner is Horizon Blue Cross Blue Shield. We partner with Horizon for a number of reasons. First off, it's name brand recognition. So that is widely recognized throughout the country. You have access to doctors up and down the state. There's no question about Horizon's strength when it comes to their network. In our program, Horizon is the claims administrator. We use them for network access, and also they are the reinsurer. If you go to the next slide, a picture says 1,000 words. And so collectively, together, we are stronger. So at AMT, we're bringing together 17 trade associations. We're bringing together a large number of employers under one label, and then we're going to go negotiate on your behalf with carriers. Horizon has been the carrier partner for a long time. I don't see that changing in the near future. But together, what we want to bring you is the best value in healthcare. If we jump to the next slide, Horizon is Blue Cross and Blue Shield of New Jersey. When you leave New Jersey, you typically leave the Horizon service area, but you're entering another Blue service area. And so with Blue Card, the majority of our plans come with Blue Card. Blue Card gives you national access to providers throughout the country. It's seamless. You don't need to ask for permission. If I wanted to go to a doctor in New York, I could make that appointment and go tomorrow. If I want to run to Philadelphia the next day, I can do that. And so Blue Card is a big piece of our program. And with Blue Card, it makes it more comfortable to buy an in-network only plan. So price is constantly putting pressure on employers to, manipulate their plans to reduce the cost. Blue Card makes it easy to give up that non-network benefit that you're not using. You may be paying for access to doctors that you're not using, and so it's something to consider. The next slide talks about, or just shows you that the healthcare or the medical benefits is really the foundation of every employee benefits plan. But at AMT, we also have dental plan options. So we've got about a half a dozen different dental plans you could choose from. You can also add life insurance to your benefit. And what we find that if you're modifying plan benefits down to save cost, you might be able to add the very inexpensive other benefit to make it a little more palatable. So it's something to talk about. It's optional, it's not required, but they are available through AMT. We partner with Delta for the same reason we partner with Horizon. It's a name that everybody recognizes in the dental industry, just like Horizon is a name that all the providers recognize in the healthcare industry.
We jump to the next slide. Well, AMT's always been about value. Again, as a not-for-profit plan, one of the things that we look to do is to control the controllable costs. Claims are claims. People are unfortunately going to get ill, and there are going to be, obviously expenses associated, with their treatment. But in controlling those costs that we can negotiate because of our size, better deals, better contracts with the vendors, better coverage options for our insureds. And the key thing at AMT is that your premium dollar here goes more towards claims than with the standard carriers. AMT operates at a level that is generally at least 10% below what the administrative portion of your costs are as compared to the standard carriers out there. You also find that in many of our plans, you can find coverage advantages for, again, a price that's less than what you would see out in the regular market. You'll find plans with lower deductibles, maybe less out-of-pocket costs than when you compare it to the conventional plan, out there in the market. Obviously, those are factors that affect cost. So we offer some of the other ones as well to give everyone the best cost options as possible. So for those reasons, it's really a good idea to take advantage of our health plan checkup. Some employers sometimes let their plan sort of ride, just not really look at it from year to year. But if you really haven't looked at the benefits and the other options that are out there, every year you'll see that there are new plan designs, new options that center around, controlling costs and still providing, great coverage value, better value. That's what AMT wants to bring to you. And if we jump to the next slide, here we can kind of graph, where AMT is, very globally, very general, but traditional insurers are out there somewhere to where about 20% of the premium dollar that you send that carrier is used up in administrative costs. And at AMT, typically it's about 10%. In fact, sometimes a little bit less. So here again, you can see that the premium dollars you send to AMT, because of our not-for-profit structure, are dedicated to offset medical costs, not necessarily to pay shareholder dividends, like some of the traditional carriers out there. This plan is about you, and it's about funding your medical costs. So I think Mike is going to jump into the importance of a health plan checkup.
Thanks, Harvey. Danielle, if you can jump to the next slide. Yep, and actually the next one. So costs are constantly increasing. They're always putting pressure on employers, and you need to look at your group health plan and change it. Don't lag, don't let it sit for 2, 3, 4 years without reviewing it. Healthcare is complicated, it's expensive, and so most people shy away from it. Don't do that. We're here to help you. There's always things that are constantly going on in the industry that are changing. Carriers are introducing new plans and new networks. There's also tax advantages that are always popping up. HRAs are becoming more and more popular, as well as HSA. The takeaway is really that you don't be afraid to look at it, review it often. You don't have to do this quarterly or annually, but every other year is probably a good cycle to be on. And now we're going to hear from an AMT client that just recently went through the checkup and their experience. So Danielle, can you get to the next slide and play the video?
Nice Lumber is a building materials supplier. We provide millwork, lumber, cabinetry, decking, railing. We have a hardware store, paint store. So we do a little bit of everything. Our considerations when choosing a health plan are directed at the value that it's going to bring to our employees while considering the financial implications for our business. The biggest challenge is always premiums.
Our staff, particularly Mike Lenihan, met privately with the owners over at Nice. From the health plan checkup, we determined that there were different options that brought about even more value to Nice Lumber.
So Nice was looking at a renewal rate increase that they couldn't afford, and we found that if we moved them from their traditional EPO plan to an Omnia product, we were able to significantly reduce the cost without really stripping away benefits. They kept the same access to hospitals and doctors and labs, but they did take on a little bit of a RX deductible, but considering the rate offset, it was well worth it. Nice was looking at about a 20% rate renewal. With the plan modification, they were able to come in 10% below what they're currently paying. So they pushed off the rate increase and were below current rates.
We encourage all of our members to undergo the AMT health plan checkup. If you have not looked at your benefit plan over the last 2 or 3 years, you're probably paying more than you should versus a plan that actually costs you less and perhaps even deliver more satisfaction to you and your employees.
They absolutely helped. They helped us, they helped our employees. And again, nothing really changed. Our employees didn't notice any lapse in coverage and we saved some money. We are thrilled with AMT. We're thrilled with their people and we're thrilled with their ideas that they bring to us when it comes to choosing.
Okay, well, on my screen, I didn't see that the video portion played, but I did hear the audio. I'm not sure if that was the same for everyone else or not. But the key there, was Mike and his staff, to get out and work with our member, and again, to find them the best option. If you jump to the next slide, one of the things that we've been talking about is balancing in-network coverage, with cost. Way back 20 years ago, the old comprehensive major medical plans were being phased out, and the new program on the block was direct access, and that kind of introduced network coverage to people, generally with an option to go in and out, because the world before that was very used to out of network, options. And again, the market has, continued to proceed in that direction. So from direct access plans, PPOs prior to that, to today, exclusive provider organizations, which essentially give you in-network coverage only. Now, one of the things that Mike talked about before, which is so very important, is Blue Card. Blue Card gives you that national access, something like over 800,000 providers, doctors, hospitals, labs, you name it, that are in network, across the whole country. So, as Mike noted before, you could be in New Jersey today and Pennsylvania tomorrow. You could be on vacation. You could be, in Florida or Arizona, California, wherever you are. But if you need medical attention and you access the provider who's in the local Blue Cross plan, you're still in network on our plan. So that provides, great coverage, again, throughout the whole country at significantly lower costs. So that's something to really take a look at. We find that a lot of our employers, have been buying out of network coverage simply on that. Well, what if? Well, there are so many providers. If you really take a look at that that Blue Cross network, and it's one of the major reasons we contract with Blue Cross, is because of the size and the scope and the quality of the network that they provide. So this shift to EPOs has certainly saved a lot of money, a lot of employers' money, and it's more standard today than ever before. Obviously, again, if you do in other than an emergency, if you have an emergency and you see an out-of-network provider, that will be covered. But other than that, you need to stay in network. So again, covers out-of-state travel anywhere you go, but an EPO plan with Blue Card is a great way. And I know the slide says to get the in-network coverage you need, but I believe it's a way to get the coverage that you need at a significantly lower cost. The next slide.
Thanks, Danielle. So at AMT, through our plan portfolio, we've got a number of Omnia options. So they're AMT plans at AMT pricing. Omnia is a creative way to reduce costs without giving up access. So Omnia is the same exact network of hospitals and doctors and labs that we use for our EPO plan and our direct access plan. What's kind of interesting is in Omnia, we're going to divide the network into two pieces. You've got tier 1 and tier 2. Typically, the plan designs are designed where we're going to improve the tier 1 coverage is going to be richer than the plan 2 coverage. And so if you can stay in tier 1, you're not giving up anything. You can move to Omnia, but you're still not giving up access to all of your doctors. We just encourage you to use tier 1 versus tier 2 because of the coverage levels. But that's up to you. Significant savings in the Omnia platform, very easy to use. There is no difference in quality between tier 1 and tier 2. It's just that we're trying to push you in tier 1. We believe the coverage is better managed in tier 1. The providers are actually incentivized if their outcomes are better. So if the recovery times are shorter, if there are fewer complications, if you are healthier, it's less expensive to the plan. And so there are savings in your monthly premium. And we also share some of those savings with the physician. So that's kind of Omnia in a nutshell. So I'm going to pass it back to Harvey to talk about HSAs.
Great, thanks, Mike. And if we could switch to the next slide. You know, HSAs, regardless of platform, if you have a high deductible health plan that's compatible with an HSA, you know, that can be a great way to provide, you know, healthcare. These plans operate around a higher deductible, but not ridiculous deductible. It's still affordable. And the great thing is that the government allows you to put pre-tax money aside in a bank account, basically, to fund, you know, those out-of-pocket expenses, things like deductibles or co-insurance amounts, you know, all the way up to the move. So that funding is extraordinary because, again, it's on a pre-tax basis, and it allows you to use those funds to pay those types of, you know, out-of-pocket costs. And HSAs are regulated by the IRS and will allow for eligible expenses that may not even be part of your health plan. You know, things like you know, glasses if you don't have dental coverage, braces. You know, a number of different types of expenses are still eligible expenses under your HSA account. So you can use pre-tax dollars to pay for those expenses, and that's a great way to do it, to allow the tax code to work to your benefit. You know, HSAs, you know, unlike FSAs, they continue to roll year after year. So the money you accumulate, if you don't use all the money in 1 year, it rolls into the next year. HSAs can be funded by the employer, by the employee, or a combination of both. And the great thing is, 2023, an individual can invest as much as $3,850 into their HSA, even though our plans, many of them come with a $1,500 or $2,500 deductible, so you can actually fund beyond your deductible. Families can set aside $7,750. So those tax deductible contributions into this health savings account is a terrific vehicle to fund expenses. When you do use the HSA account to to pay for those expenses, they're tax-free, and that's great. Interest and other earnings are also tax-free, and as I said before, that those balances are carried forward year to year, all the way to age 65. And generally, when you become eligible for Medicare or any other insurance plan, you can no longer contribute into the HSA. But at 65, you can take that money out for any reason. You'll pay income tax, but no penalty. If you do take the money prior to age 65 for expenses that are not related to eligible medical expenses, you'll pay not only income tax, but a 20% penalty as well. But again, the idea here is to use those monies for medical eligible expenses. And when you do that, they provide a great mechanism to help funding. So again, the combination of contributions into the HSA, many times the cost of the plan is significantly lower than what employers were paying previously. So employers are able to redirect some of that savings into their employee accounts. So it's kind of a win-win-win. It helps the employee, certainly helps the employer as well, and it also maintains coverage levels that most people are used to. So something definitely you should take a look at, regardless of platform. These plans can work with both EPO as well as Omnia. And if you're still out there on direct access, those two, even though those are the ones we don't recommend nowadays because of cost. Looks like the next slide is our case studies, and Mike is going to jump into our case studies.
Yep, thanks, Danielle. So this slide actually has 2023 pricing for a 48-year-old employee with family coverage. And you can see the top plan. This employee or employer combined is paying almost $5,000 a month for this coverage. This is a Rolls Royce of a plan. This plan was popular 10, 20 years ago. Extremely rich. In-network, no deductible. In-network, no co-insurance. You had 100% co-insurance. Co-insurance is just a fancy word for cost sharing. This is very rich. You've got other plans where the co-insurance is 80-20 or 50-50, but this one had an in-network co-insurance at 100%. This plan let you go out of the network with $1,000 deductible, which is out of network is incredible. Most plans today have in-network deductibles that are higher than that. And so this is a plan, and if you look at the plan at the very bottom, you can see a drastic decrease in coverage. We're going from almost $5,000 to about $1,500 a month. If that person moved to that plan, they'd save about $38,000 a year. But they're taking on liability. What am I giving up to save that $38,000? I now have a $3,000 deductible, which is not terrible, and 50% co-insurance. And 50% co-insurance can be a little scary, but all of these plans are going to have a maximum out of pocket. So the maximum out of pocket on this plan, if I got real sick, number of days in the hospital, surgeries, you name it, I have $1 million claim or more. The most I'm going to pay is $6,850. That's the move, that's the max. So you could stick 38 in your pocket, 38,000, and take on about $7,000 of risk per person. The family max is under 14,000. So I think that makes sense. But if you're not comfortable with that extreme, there are lots of options in between. So the first set of plans underneath our original plan are EPO platform plans. The first one, you take on a little bit of a deductible and you take on some co-insurance, significant reduction in savings. The middle plan and the EPO plan platform, similar savings, but paired with an HSA account. So you can take some of those savings and fund that liability. You could also go to increase the deductible even more and take on more co-insurance in an EPO and have similar savings. What's kind of interesting is now we jump to the next plan platform. In that Omnia plan design, we're saving money significantly, but our tier 1 level of coverage, no deductible, and 100% coinsurance. So there with Omnia, I'm able to keep a high level of coverage in tier 1, take on the risk in tier 2, but save some money. So this is just an example of a number of the different changes that are available. It's kind of like a snapshot. These 7 plans are not our favorite. They're just 7 that we chose randomly. This just show you some offset, how you can move and massage plans to hit a price point that you're comfortable with. Danielle, if we go to the next slide, we're going to talk about an employer that made a change in our plan. So here I've got an employer. It's got about 25 employees, all on a very high-end EPO plan. So, you know, they've been making some plan changing. They're keeping up with the times, but maybe not moving as quickly as they could. The employer, you got to a point where you said, you know what, I can't afford this. I can't keep pushing on these increases, sharing them with my employees. I need to do something. What can we do? So we introduced a deductible. We added a $2,500 deductible, and we also introduced some cost sharing, 80-20%. The plan is going to pay 80. The employee is responsible for 20. We did not change the network of hospitals and doctors and labs. The office visit setting coverage did not change. I go to the doctor, I pay my copay. I run to the pharmacy and I pay my copay. So they were willing to take on some risk on the diagnostics and the inpatient procedure to reduce the premium. And they were able to see a 31% reduction in premium. And the employees also shared in that reduction in their payroll contributions. So this is a pretty easy change, sticking on the same platform. They were able to reduce their costs significantly and accomplish the goals that they wanted to meet. Danielle, if we go to the next slide. So here, a little bit of a smaller employer, about 8 employees in the plan. They were in our EPO plan with a deductible and coinsurance, but needed to reduce the cost. This company was struggling with COVID. There, you know, the cost of healthcare is really hurting my business, the cash flow, my profitability. I need to make a change. So we went from an EPO platform to the Omnia platform. The price reduction was 54%. So that's an extreme reduction in cost. They took on more liability in the Omnia product, but the tier 1 level of coverage, the deductible went up $250, you know, pretty irrelevant. Office visits were still covered with copays. The tier 2 level of coverage, the deductible was higher, and we bumped up the MOOP a little bit, but it was more important to save money than maintain the highest level of coverage. So they were able to accomplish that by moving to Omnia. Danielle, if we go to the next slide. So this employer, very closely held family business. Dad working in the business, 2 children working in the business with dependents. They're on a Rolls Royce of a plan. Has in and out of network coverage, 100% coinsurance levels, deductible and coinsurance out of network. They've got out of network access, but they say, we can afford it. I don't want to make a change. The business is paying for this. I don't want to manipulate the plan to hurt myself or my kids. So I said, we're not going to hurt you or your kids. We're going to change the plan a little bit. We're going to move you to an HSA. So by going to an HSA, same plan platform, so they kept the out-of-network coverage. They actually improved the out-of-network coverage by 10%. In the original plan, the out-of-network coverage was at 60. In the HSA, it was at 70%. They kept 100% in-network coverage, kept the out-of-network coverage, but with an HSA, in order to be compatible, you need to add a deductible. And so the single employee took on a $1,500 deductible. The employees with dependents took on a $3,000 deductible. So they took on a liability of $7,500. The reduction well covered the deductible. So that, the the father who's running the business says, we'll all go to HSA. I'm going to take the premium savings and I'm going to put it in your HSA accounts. So we've got the same level of coverage. We're not losing anything. And what's really interesting, if you don't use your HSA money, that's going to roll over from year to year. So you can accumulate funds where in the original plan, they were paying premium gone. So this was a win-win. It was an eye-opener for them. They had no intention of making a change, but we convinced them to, there are tax codes that you could take advantage of to get to manipulate your plan and make it a better value. And so whether it's HSA or HRA, if you've got questions, we'd love to talk to you. So, that's, if we go to the next slide, hopefully we've convinced you to take a look at your plan. It's very easy. You can give us a call. We'll take some general information. We want to know who we're covering. And if you give us their ages and their dependent status, we're going to generate proposals for you. We're going to ask you about utilization. We want to know what you like about your current plan because we want to keep those features. And we also want to know what you don't like about the current plan because we'll see if we can make that go away. The whole process is painless. Healthcare is wildly expensive and it's also confusing. We're here to help. So feel free to reach out to us. Danielle, if we jump to the next slide. You can read, if you go on the web to amtcheckup.com, you can actually schedule an appointment, or give us a call. Working together, that is the goal here at Association Master Trust, is to find the plan that fits, that most meets your needs. Everybody's utilization is different, so we'll have that conversation and we'll point out features in your current plan that are working or not working, and we'll also make a comparison and we'll let you know if our plan is better, we're going to point it out. If our plan is worse, we're going to point it out. If you have a plan that's working, you may want to keep it, but you won't know that unless you take a look. So Harvey's now going to talk to us a little bit about Horizon's Advocate plan.
Great. Yeah. Thank you, Mike. And Danielle, if we could go to the next slide. AMT has decided to buy into a new Horizon initiative, benefits that allow for, again, even more service. And again, we're very, very confident and proud of the service that we provide. But this program, which is available to large group plans like AMT, but again, available to every participating member in AMT, regardless of size, really tries to take on some of those burdens and help you through, the maze of, service and claims and a number of different types of things that can be confusing. Everybody is busy today. You're trying to run your business, and then healthcare concerns come up either for you or an employee. Here you get personalized service, again with a dedicated rep, this time at Horizon, and they can be really helpful in some of those decisions that you have to make that are tied to getting your care. Selecting the right in-network doctor. You may not have an experience with the doctor, so you might want to look and see who can help you through this process. What type of specialized care do you need? And this patient advocate at Horizon can help you do that on a personal one-on-one basis. If you've got questions, when things are going on, you listen to the doctor, but it's really easy to get confused. You can connect through the patient advocate, with a nurse at Horizon who's there to help you in understanding the treatment course that they want you to follow, to help you manage and give you suggestions on how to manage that chronic illness or that really complex situation. Unfortunately, when there are big claims involved, big illnesses that require a number of different specialists, these advocates can be tremendous help, and the nurses can really make you more comfortable, with the whole process. They also can work through with your benefits so that you understand where your coverages are, and how to best address any out-of-pocket costs that you might have. In care, they can identify, risks. Sometimes it can be, different RX drugs that may not be compatible. Or do you need help? Do you need some rehabilitation help? Do you need someone to come into the home? They can help you with all of those types of issues and important decisions that you have to make. Behavioral health is getting to be, since COVID, an exploding area of coverage. And sometimes it's hard to find the right program. They can help you through that process as well. So really a great program. I myself got to use the program. I unfortunately was having some difficulty in getting a minor surgery schedule. 2 weeks on the phone with the doctor's office, with the scheduler, and for some reason they weren't calling me back. I wasn't getting through to the right person. And so I said, I'm going to try the advocate. I'm going to give her a call and see what happens. And this person got on the phone with me and understood what I was going through, contacted my doctor who was in network while I was on the phone and got me scheduled right then and there. 2 weeks of me trying, I got nowhere. They got right through, in about 10 minutes. We were all settled. So boy, I'm sitting there going, wow, this is great. It's kind of unexpected, but really a wonderful process. So again, it is automatically included in our programs. There's no additional cost to you as the member to participate in that program. We think it'll be, again, another step in the best service that's available to anybody out there, which we make available through AMT. So with that, Kevin, are there any questions?
Yeah, I think Randy, for the audience, has sent out a request. You can enter questions and answers directly into the question tab on GoToWebinar. And Randy, I believe we already have gotten some. So do you want to?
Yes, sir. Thank you, guys. I want to say thank you to Kevin, Mike, and Harvey for walking us through those different options. It's good to know that it's not a one-size-fit-all opportunity here. So we appreciate that. As Kevin mentioned, we do have a few questions that popped in throughout the chat. So we'll start with number one here. And it is the Omnia plan available with the Blue Card?
Mike?
Yeah,
Sorry.
thanks. So Omnia is available and Blue Card is available on most of our Omnia plans. We also have a couple without Blue Card, but yes, Blue Card is available with Omnia.
Awesome, thank you, guys. We do have another question here. We'll just kind of dig right in. And does any of the AMT plans offer any health coverage for international short-term or long-term travel? Excuse me.
Yes, they do. And as a matter of fact, Horizon actually has network doctors internationally, generally around airports and depending on what country that you would be going to. So you may be able to access that network level of coverage even in another country. It's always best to check with us before you go so that we can make sure that there's no issues. But yes, generally our plans do offer international coverage.
Harvey and Mike, thank you. We've got another question coming in here, and it's, can I have an Omnia plan without an RX plan or prescription plan?
So all of our Omnia plans have RX built in, so you cannot strip it out. Some of the coverages, I've got Omnia plans with an RX deductible and Omnia plans with 50% coinsurance. So they're designed to meet a price point, but we can't pull the RX out of it.
Awesome, thank you, guys. We're going to just keep going here. And other than managing payroll deduction, how much of the HSA management falls on the employer versus what AMT does?
So,
sorry, Mike, go ahead.
We can bounce back and forth. Yeah, that's a great question. It's very, very little, if any. So when you enroll in our medical plan, we're going to send that enrollment information to Mellon Bank. They're going to create the bank account. They're going to mail a banking package to every employee in the plan to their home. That employee owns that account. They're the fiduciary, and so they're responsible for it. The employer would then push funds to that account. So just like if they're doing pension contributions or FSA country. If they're doing the withhold, they would push it to Mellon. So very easy to use. If they have trouble, reach out to us. We'll help you through it. But there's no cost, no separate enrollment form, very convenient and very easy.
Awesome, Mike and Harvey, you guys are rolling here, so we're going to keep going. I've got another question that says, when can I change my plan? When can I change my plan?
Well, I'll jump in on that one. Anytime, which is, it's a great thing. Sometimes the carrier you would want to check your contract to see if you're required to give notice. Some plans may look for a 30-day notice if you're going to change, but if you're going to move from another carrier to our program, you can do that anytime throughout the year. If you're in AMT and you want to make a plan change, give us a call. Most plan changes are movement down in coverage, which we do allow for. If there's some requests that they may want to move up for coverage, that's when you would want to do it during the open enrollment period, which is now. Generally the best thing to do is to contact our office, but we try to make it as easy as possible for you. And especially rolling over, remember when you move from one plan to another in the middle of the year, all those deductibles will bring forward. If you're in a plan today that has deductibles and going to a plan with another deductible, we can roll over charges that would be covered by the new plan into your deductible for this current year.
Awesome, Harvey. Thank you for that. We've got a couple more questions coming in here if you guys don't mind. And it's, do you have any details on the benefits of a HRA?
So HRAs is a way an employer can improve their current employee benefits plan. So you could have an employer that might go to a carrier and say, give me a plan with a $5,000 deductible because I don't want to pay any premium, but I'm willing to take on the risk. So they promise the employee, I'm going to jump into this plan with this high deductible, but I'm going to give you this credit card that you can use, and the employer gets to set the limits on the dollars, so it's not unlimited, but it's a creative way to improve coverages without buying insurance, and it's funded as it's used. So the employer is going to have an account that those employees' credit cards are going to and pulling the funds from. And so the employer's taking on some risk, but they are choosing to do that versus paying premium. And we'll sit with them and we'll work with them to see if it makes sense. What level of risk do you want to take? And do I want to do just RX only HRA? Is it RX and medical? Is it RX, medical, vision, dental? It's very flexible.
Awesome, Mike. Thank you for that, sir. We've got another question here. Is how about determining qualifying HSA expenses? How is that managed? Does the employee get a debit card and have to submit receipts? Does anyone you want to speak to that?
Well, through the HSA, they do get a debit card, and they can use that debit card. Generally, Mellon Bank will be able to determine if it's an eligible expense, generally by who is supplying the particular drug or care. So many times you just take out the debit card and use it. Again, you want to make sure it's for a qualified expense. You can determine qualified expenses from the IRS website, and we can direct you there as well. But the process is, again, very easy and easy for the employee as well. If down the road it is determined, because Mellon will report back to the government as far as contributions into the plan and contributions out. So if there is an audit, you'll want to keep your receipts, keep your expenses so that you can show that you use the HSA funds for qualified medical expenses. If you did use those funds for expenses that were not qualified, you would be subject to income tax on those particular amounts, as well as I remarked before, a 20% penalty. So it's, again, it's important to know, what is eligible. And again, there's a whole list on the IRS website, and to stick within those boundaries.
Awesome. I know we're pushing the end of our time here, but we have a couple more questions we'd like to try to sneak in if that's okay with you guys. Can HSA be added to any Omnia plan?
So the plan has to be HSA compatible. And so a compatible plan has a deductible up front on services. So as long as it's an HSA compatible plan, you can add a HSA.
And those, Mike, those deductibles are typically around 1,500 for individual and 3,000.
Yeah, yes, they're not ridiculous.
Awesome, thank you guys. Let's see if we can sneak one more in here. And it's, if we change plans in October, does the out-of-pocket expense from January or September apply to the new plan effective October 1st?
Mike, maybe you should take that one.
Yeah, so you can obviously make a plan change throughout the year. And what most people are concerned about, I just met my deductible or I've met some of my deductible. I don't want to make a change till January. The industry, because of the load that would be up upon carriers if everybody changed every January would be ridiculous. So every carrier will give you deductible credit. So if I've met some of my deductible or all of my deductible at Aetna or United, if you send us the explanation of benefits that shows us that, we're going to credit the Horizon system and give you the credit for that deductible.
Awesome, awesome. I'm going to sneak these last two questions here in before we wrap up, guys. And I just want to let the audience know, if you take a look at the chat, there's some information that Danielle has left for you guys to reach out to AMT directly, just because we don't have time to probably get to all of these, but I'll sneak these last two in if it's okay with you guys.
Please.
Awesome. Okay. Do you know the current interest rate on the HSA savings account?
So that's a great question. It's Mellon's product, and so that interest rate is going to change. Interest rates are starting to creep up, but you typically get a money market account. What is interesting is Mellon has a portfolio of mutual funds that are also available. So if you're unhappy with the interest rate and want to put the money at risk, you can buy stocks and bonds and gold and real estate and all sorts of things through their mutual fund program.
Mike, thank you for that, sir. It's what is the minimum number of employees a company has to have? And let me open this up to participate in one of the plans.
Well, what's great is that we actually go all the way down to one employee, when it's appropriate and that employee is running a business and is actively at work in that particular industry. So again, if there is interest, contact us and we can go through the process to determine if you're eligible to participate, in AMT. So, our market segment actually goes from about, one life in employee groups all the way. And, our largest groups generally, round out at around 1,000, 1,200, maybe 1,500 employee lives. So we play in a number of different market segments, micro employers, the small ones, the, 1, 2, 3, 4, 5, the more beefier small group employers up to 50. The next segment generally goes from 50 to 100, and then 100 to 500, and then from 500 and up. So we operate in most of the segments in the healthcare market, and again can bring great options to each segment.
Awesome. And guys, this is the last question here. And again, audience, please see the chat if you have further questions where you can reach out to AMT directly. And I'll close off with this question here, which it says, for the Omnia plan, is there a list of tier 1 and tier 2 providers available?
So that's a great question, because how can you jump into a plan not knowing whether your provider is tier 1 or tier 2? Through our webpage, there's a Horizon link where we can look up providers and determine what tier they're in. We can help you with that. So if you've got a handful of doctors you want us to look up, we'll actually look them up for you. And we can actually, you don't have to be in our plan to do that search. You can search as a guest. So it's interesting. And what we're finding is there are a lot of tier 1 providers that are out there. Our office is in Short Hills, and so there's a local practice, the Summit Medical Group, which a lot of people are very comfortable with. Summit is a tier 1 provider. So, you need to determine whether they're in tier 1 or tier 2. If you find that the majority are tier 1, Omnia is a great product.
Thank you, guys. That's all the time we have for questions today. Harvey, Mike, or Kevin, do you guys have any last words or thoughts for our audience?
Mostly, I just want to thank everyone for their time, taking this hour to go with us, through this AMT journey. We think we can be a help to you. So certainly reach out, contact us. We'll be very, very happy to speak with you and try to help.
Awesome. Thanks again. We want to thank our audience. We want to thank everyone from AMT that's joined us. Don't forget, all of you will be receiving a recording of today's webinar and the PowerPoint slides via email. Lastly, when you close out of the webinar, a survey will come up on your screen that we hope you will fill out so we can understand how best to provide you with important information in webinar format. Join us for our next webinar, HR on Demand, support 5 days a week on November 10th. To register, visit our website at njbia.org. Until next time, for Kevin Kuczynski from Princeton Partners, Harvey Michigan, and Mike Linehan from Association Member Trust, this is Randy Stevens. Thank you for being with us today and wishing you all a great afternoon. Thank you, guys.
Thanks, Randy.